Yeah,
Okay,
so I can roll back a little bit. All right, so Dr. Parag is gonna do over here the exosomes on my scalp, and people say, "Why do you need it? Everything looks good." Exactly, that's why I need it. So continue to stay good, right? Why do you work out? You look good? No, because you want to stay looking good and healthy. While Dr. Parag is doing that, I'll give you my movie pick for the week. I don't know if you've seen that movie, but I watch it. It's a very interesting movie, and I love movies based on history and true stories. This movie is called Bigger. Not like the movie Big with Tom Hanks. Now that was a great movie. Watched that one a couple of times. But this is Bigger, and it tells the story about two brothers, and I'm trying not to ruin it for you, but two brothers who really revolutionized the way we look at bodybuilding and broke the mold and the preconceived notions about what is allowed and what is healthy in terms of workout, because there was this misconception that if you work out too much, you have this athlete's heart, where you have the heart becoming, weaker because you overwork it. And the answer is that it was not true. And what he did with it, followed his dream. And it's a beautiful, inspirational movie to watch. Some famous people, you'll see how they got their start. They bring them up in that movie. And it's, I think it's PG-13, so you can watch with the kids. I think it's good for kids to watch it too. And that is my movie pick of the week. So back to what exosomes are and why I like them. Exosomes are basically messages. They are messages that are used by cells to tell other cells what to do. And in this case, the ones that I'm using right now are ones from the part of the placenta that I can hold it for you. Are you done with that one already?
Done. I'll pick it up.
All right, so I'll just hold it. I got it. I'll hold it. You concentrate on the bed. So the messages are from the placenta, from the jelly around it, and those messages make sure that the baby forms properly. And when we do the exosomes on the scalp, we make sure that the hair is going back in age and is doing what it needs to do, which is to regrow, regain its color, and the DNA that is locked over there, you can have it here, I'll hold it. The DNA that is locked over there is reopened again, and everything gets back into its proper position and order, so that the hair cells can be doing what it needs to be doing as a normal hair cell, as opposed to getting confused and getting messages of, let's say, a skin cell and becoming gray or something else. So we're going to recover the color, and then I did notice color recovering, and I did notice less hair falling out. Usually I do it once a month. You can do once and then the second session in 2 weeks. Some people used to say that it's one session is enough. I disagree with that, and now they're all coming to the realization that I was right. One session is not enough. And we charge here a much cheaper price because I want it to be accessible to people. And Dr. Parag does a great job, and as you can see, she's doing it for me. In terms of level of discomfort, some areas are more sensitive where the skin is thinner, some areas less sensitive, and of course it's operator dependent how they press on the area, and you don't have to press too hard, but you need to make sure that you have enough little channels so that the exosome will penetrate inside to the level of the hair follicle. And as we discussed before in other videos, it's not really the hair follicle but the hair bulge, right? So that was discovered later on when they were doing hair transplant, and the hair follicle would be cut off, and they're like, how did the hair regrow if the hair follicle is not present? And the answer was because they had the hair bulge was intact, which is an area located right next to the muscle, between the muscle and the sebaceous gland. Is that right? Am I saying right? That's where the hair bulge is? Yeah, okay.
Yeah, under the erector pili muscle.
Right.
Yeah.
So the medical term is the erector pylori muscle, right? You may like the first part of the word, but it just means that it lifts the hair follicle, you know, like when you have
Goosebumps.
the goosebumps in the cold, right? Which is another way to make sure that you're getting younger, is if you're out in the cold and get little goosebumps. Yep, that means that that's the right temperature, either more hot or more cold. And this is what we're doing right now. And you can do it for other things obviously as well. So hopefully this is educational. I'm not gonna bore you with watching the rest of the procedure, but do you have anything that you want to share with them about it?
We have like very, very good results. It kind of thickens the hair also. It gives a very nice texture.
Sure.
So it's highly recommended.
Yeah, yeah. And I combine it with other stuff as well. So I combine it with CO2 resurfacing, which is a gold standard for wrinkle removal. I combine it with the chemical peel, as you've seen me do. It's actually on the post. And if you want to watch more, you can watch also on our YouTube channel, Levit Dermatology. And just we're concentrating more on the areas where there's more gray hair in my case. I don't know, am I like gray hairs everywhere or like...
You have. Here.
Okay.
Here in the front, yes.
Also, okay, right, so we're doing that. So most male androgenetic alopecia, which is what I have, is by temporal. So I started losing at the age of 16. When I didn't realize it at first, of course, 16 I was not close to even being in med school. I didn't even want to be going to med school. I don't know, did you want to go to med school when you were in high school?
Yes.
You did? Oh my
yes,
God.
I knew it from the beginning.
Nah, I didn't want to go to med school. I want to be a writer or an athlete. That's what I want to be. Yeah. Anyway, so later on I looked at the pictures and I saw, so that's when I started losing hair, after 16. And I started getting my treatment when I was already a resident in dermatology at 24. Because I knew everybody in my family is bald if I didn't help them take care of the hair. So this is important that you will start early to take care of it, so then you don't have to go through the pain and torture of a hair transplant and do stuff later. It's kind of like everything in life. If you can start it earlier, you're having a head start. You know? Just like with exercise, just like with studying for exams. Not that I'm not a procrastinator, but in this case, it's important to start early and get much better effect. And in the future, I think there are places already using it, but we'll let you know how it's working for some of the patients that we're using it for internal inflammation, like blistering disorders and arthritis, because we use it also for that. And for those cases, you would need to either inject it into the joint, and that's I use different amount of exosomes, different types of exosomes, or doing it IV. So I'll keep you guys posted on that, how the results go when we do it. If the patients don't mind, maybe we'll even show. Are you here Monday?
No.
No, that's a shame, because that's when we're gonna do the IV infusion. You know, I wanted to do it for my eyes to see about my vision, how it improves, but we'll see. It's just so expensive, I don't know. Try. The material is like $2,500 to kind of inject into your eye. I mean, not inject, I would just pour it, like drops. You can do it harder.
Yeah?
Yeah. It's good because I had a headache. Now I don't have a headache after this.
I'm trying to achieve that it's gonna be, that it's red.
Right.
Yeah.
You know, the hairdresser himself noticed that the hair became darker and thicker. Quality improved. But the only thing is that we need to document when I get it done, because it's kind of like haphazard. We have a little second here, a little second there. You should try it too. I mean, I don't know if you need to know.
Me? Yeah, probably I need it.
We could all use it. We could all use it. I know.
Yeah, probably I need it. Probably.
Did I do it for you on the face as part of the chemical peel?
No.
Ah, you should do it. Leave a little bit and we'll do it for you if you want to.
Okay.
Everybody's very happy. They love it. You can see the glow and it's like amazing.
Yeah. Also, after the laser, they recover so fast and they have such nice results.
Yes. You mean when we do the secret or CO2?
Both.
Yeah.
With both.
Yeah. No, definitely.
On the other side, you have much more gray hair than this side.
From this side, I have more.
No, in this side you have less. Here you have more.
I have on the left side more.
Yes.
Interesting. Oh, look, I don't sleep enough. I stress. It's not like I can control most of it. It's like 1:30 in the morning. I wake up. This last week I've been waking up 1:30 in the morning, and 12:30 I woke up. I look at the clock. Okay, I'll sleep some more. And then 1:30 I'm like, what's the point?
The jet lag.
Yeah. And you can push yourself, but I don't like just laying in bed and trying to every half hour look at the clock and wake up. And it's a waste of time. So Dr. Parag is very knowledgeable in cosmetic procedures. She does a beautiful job with fillers, Botox, lasers. So if you have a desire to get amazing results with a caring, knowledgeable physician, Dr. Parag is available. So don't hesitate. You can give a call to the office, and Monica, our cosmetic coordinator, will help you set the appointment. Of course, I'm always also happy to see you guys, but honestly, trust me, you're getting the same treatment. And
the feminine touch.
And a feminine touch. That's right. The feminine touch. Right, so you'll be very happy. And those who've tried have told me that they like it very much. They like me. They told me it's like, why didn't you get her here earlier? They tell me. Like, well, they didn't let her go in Israel. That was the problem, I told them. By the way, Dr. Parag is very humble, but she's coming from a long line of very, very famous physicians. Very famous physicians.
Is any other area that you'd like me to focus on?
Well, no. Wherever you think is like, it's
it.
fine. So we're doing it mostly for graying hair, I guess, today.
If you want, I can do it a bit here in the front.
No, leave a little material for yourself. Is there stuff left?
Yeah, there is.
Okay.
There is stuff left.
Right, so why don't you do it then? Is there something in the back, gray hair?
You have everywhere like a small amount. I don't know. Here,
Right, so where's the concentration then? What in the middle? Yeah, wherever.
Maybe here you have it.
Okay, so put a little there.
We can try it here.
So interesting. The occipital scalp, the receptors of the hair follicle. Occipital is the back of your head. Scalp. You notice this is like the crown hair. They keep their hair there. It's like the Ben Gurion hair, which is the first prime minister of Israel. But you know he had a crown of gray hair that went around it. So those receptors are different than the receptors found everywhere else, which is why when you transplant hair, you take it from that area on the back or the side of the head and you transplant to the front, and those hair follicles are not susceptible to the dihydrotestosterone, the chemical that causes the hair follicles to become smaller, miniaturized, and then shorter anagen, shorter growth phase, and then fall off. So that's why you see people, the ponytail, the guys, they're all no hair, but they keep their hair in the back and then draw it in like a ponytail. That's the area that still has energy and can grow longer. if you actually look at the picture of Botticelli of Venus, you see her, you know, being born in the wind in the you see it like it was that basically long hair shows virility and sexuality and all that kind of stuff. So yeah, all right, looks good.
Okay.
Mohawk over there, and now we're gonna do also for Dr. Parag a little bit of a chemical peel. So why don't you have a seat?
I have a lot of makeup on.
You don't want to do it, Tom? Or you don't want to do it on paper?
Maybe not on camera.
All right, so we'll do me on camera. We'll do me on camera. I've just removed all my makeup, so you guys are fine. We'll do it to me. Here we go. So let's do mine. Here we go. Here we go. Here we go. Good?
Yeah, we did. It's harder because of the hair.
Yeah, just
Yeah.
Just rub me hard, rub me fast, and it's over.
Just where you have
Don't have to
facial
be so
hairs.
nice. Hey, go the other way. Go this way. Yeah, exactly.
With the way of the
Mm-hmm. And also the lips.
You want? Yeah, this is what I wanted to ask. You want? Okay.
Mm-hmm. Rub hard. You want the peel to be more effective, yeah. Yeah, so I can feel a little tingling now. It feels actually nice and fresh.
I do also the neck.
Thank you. I'll help you.
Okay. I'm
Can
just
see.
folding. I just want to fold.
Here we go. Can do it under the eyes. Okay, let's put the second one. Wow, nice. I feel fresh. I feel burning a little bit, which is good. No, I do. It's good.
I know.
I feel hot. Good.
Yeah.
You're doing some of the non-feminine touch.
Yes, exactly.
Good. Rub it.
Just fold it. So it will be
Why don't you grab the exosomes already? Here they are. Oh, you have there. Left? No, here.
Oh, this one's yeah.
Yeah, it's already there. Alright. Don't give me everything. You use for yourself.
Oh, I gave most. I'll give you.
Okay, I'll give you more. Okay, can I have some of it? Put a little bit on your cheek, if you have left.
That's it.
Let me do it. Mm-hmm. Under the eyes. Thank you. And then put a little vitamin C
yeah.
on top. And then we're done. And then we're gonna say goodbye to you guys.
It's like a makeover show.
Yeah. Total makeup. Total makeover, I think.
And more. It's fine.
Yeah, a little bit more. I'm just gonna put a little bit of the vitamin C. Vitamin C is great, especially now that you have viruses going around.
Today I just told someone that they can put it on their face and kind of it's like an antioxidant. So it's,
correct.
helps a lot for the skin.
It's best to do it in the sun. All right, my friends, if you have any questions, don't hesitate to call. And Dr. Parag, she's top of the top, so don't hesitate. Make an appointment and we'll help you. Take care. Shabbat Shalom.